There are several nighttime signs of diabetes that you should know about, and it's crucial to recognize what your body is trying to tell you. Ignoring these signs can lead to more severe complications, especially with your organs like the kidneys. So let's dive into these important signs. Frequent urination. The first sign you might notice is frequent urination at night, known as nocturia. When your blood sugar is too high, your kidneys work overtime to filter out the excess sugar. As your body tries to rid itself of this sugar, it also removes water along with it, which can leave you dehydrated. This is why you may find yourself waking up multiple times during the night just to urinate. For some people, this can happen as often as 10 times a night, significantly disrupting their sleep and leaving them exhausted during the day. This constant urge to urinate isn't just inconvenient. It's a sign that your blood sugar levels are dangerously high and affecting your kidneys. Excessive thirst. Frequent urination leads us to the second major sign, excessive thirst. When you're constantly losing water, your body naturally craves more to make up for the loss. But there's more to this. When your blood sugar levels are high, your body tends to retain more sodium, causing a vicious cycle. You keep drinking water to quench your thirst, but it doesn't seem to help because the more you drink, the more you urinate, and the more dehydrated you become. This cycle also depletes essential minerals like potassium, magnesium, and calcium, further aggravating the condition and making it harder for your body to regulate itself. Restless leg syndrome. Next up is restless leg syndrome, which is often linked to diabetes. This condition can make your legs feel extremely uncomfortable at night, and you may feel the urge to constantly move them. Restless leg syndrome is commonly caused by a deficiency in vitamin B1. High blood sugar depletes this important vitamin, leading to the buildup of lactic acid in your muscles, which prevents them from getting enough oxygen. This lack of oxygen can make your muscles feel fatigued and cause restlessness while you're trying to sleep. Magnesium deficiency, often seen in people with diabetes, can also make this condition worse, as magnesium helps muscles relax. Diabetic neuropathy. Another related symptom is diabetic neuropathy, which affects the nerves in your feet. You may experience burning, numbness, tingling, or even sharp pain in your feet, especially at night. This happens because the nerves in your feet are damaged due to high blood sugar levels. And lying down can worsen the issue as blood tends to pool in the lower parts of the body, putting more pressure on already damaged nerves. To alleviate this, a combination of B vitamins and alpha-lipoic acid can be very helpful as they work together to support nerve health and reduce symptoms of neuropathy. Leg cramps. Leg cramps are another common nighttime issue for diabetics. These painful cramps are often the result of magnesium deficiency caused by high blood sugar. Magnesium plays a vital role in muscle relaxation, while calcium controls muscle contraction. When you don't have enough magnesium, calcium builds up in your muscles, causing them to contract and cramp. Magnesium glycinate is a good supplement to consider here, as it helps with both muscle relaxation and improving sleep quality. Excessive sweating. Excessive sweating, particularly on the face, neck, or upper body, can also be a warning sign of diabetes. This isn't the same as night sweats caused by menopause or other hormonal changes. Instead, it's a result of the body's blood sugar issues triggering the fight or flight response, which activates adrenaline and puts your nervous system into overdrive. This state of stress can cause you to sweat, even when you're not particularly warm or physically active. Both high and low blood sugar levels can trigger this response. Sleep apnea. Sleep apnea is another symptom that often goes unnoticed, but is common in diabetics. Sleep apnea occurs when your breathing is interrupted during sleep, often due to an obstruction in the airway. This is frequently linked to high insulin levels and insulin resistance, which are hallmarks of diabetes. Insulin is a fat-storing hormone, so elevated levels contribute to weight gain, which increases the risk of sleep apnea. If left untreated, this condition can seriously disrupt your sleep and overall health. Hypoglycemia. Another issue diabetics face is hypoglycemia, or low blood sugar, during the night. High insulin levels can cause your blood sugar to drop too low while you sleep. This often leads to the release of adrenaline and cortisol, which can wake you up suddenly in the middle of the night, feeling anxious or stressed. This can be particularly frustrating, as it disrupts your sleep and leaves you feeling fatigued the next day. Delayed sleep onset. High blood sugar levels can also interfere with your ability to fall asleep. Diabetes affects the release of melatonin, the hormone responsible for helping you fall asleep at night. So even when you're tired, you might find yourself lying in bed, unable to drift off. Gastric reflux, or GERD, is another symptom that can cause discomfort at night. High blood sugar affects the autonomic nervous system, which controls many of the body's internal functions, including the valve that keeps stomach acid from rising into the esophagus. If this valve doesn't function properly, you may experience acid reflux, making it difficult to sleep flat without propping yourself up with pillows. Managing your blood sugar through diet can help reduce these symptoms over time. Nightmares or vivid dreams. Nightmares or vivid dreams are also common for people with diabetes. This is often related to a deficiency in vitamin B1, which affects neurotransmitter production. High carbohydrate intake or being diabetic can deplete your B1 levels, leading to these disturbing dreams. Non-dipping blood pressure. Blood pressure that doesn't drop during sleep, known as non-dipping, is another subtle but serious sign of diabetes. Normally, your blood pressure should decrease while you sleep, but with diabetes, this may not happen. You might not notice this, but it can leave you feeling more awake at night and can contribute to other complications. Heart palpitations. Heart palpitations during sleep are another warning sign, often caused by an imbalance in electrolytes like potassium and magnesium. These minerals are essential for maintaining a steady heart rhythm, and a deficiency can cause your heart to beat irregularly. Teeth grinding. Teeth grinding, or bruxism, is yet another potential nighttime sign of diabetes. This happens because high blood sugar triggers your body's stress response, causing your jaw muscles to tighten and grind your teeth while you sleep. Morning headaches. Finally, waking up with headaches in the morning is often due to dehydration. High blood sugar levels cause your body to lose more fluids, leading to dehydration, which can cause pressure and pain in your head when you wake up. If you're experiencing any of these nighttime signs, it's essential to take action. Ignoring them can lead to long-term damage to your organs, especially your kidneys. Managing your blood sugar levels through a low-carb diet, staying hydrated with electrolytes, and taking the right vitamins can go a long way in reducing these symptoms and improving your overall health.